So in anatomy, we frequently talk about bodies, and we need to know what position the bodies are in. And there is a certain stance called anatomical position. The person would be standing with their legs together, not tightly, but just, together loosely, and their hands at their sides with their palms facing forward. That is the only unusual part of anatomical position because ordinarily we stand with our palms facing the sides of our body, not facing forward, if you think about it. But for anatomical reasons, the anatomical position is standing with your legs together and your hands at your side with your palms facing forward. Then there are two other positions that sometimes come up in anatomy and come up quite often clinically, and those are the supine position and the prone position. Supine position is lying face up in the anatomical position. To learn this position, you can learn that the hands can hold bowls of soup. So soup, supine. Get it? The prone position is lying face down in the anatomical position. So moving on to anatomical directions. Anatomical directions are used continually in anatomy. And an anatomical direction is the location of a body part in relation to another part of the body, always in the anatomical position. Right and left refer to the patient's right and left, right? Not our right and left. And there are multiple anatomical directions. They're paired. So superior and inferior can be used as anatomical directions. Anterior and posterior, medial and lateral, proximal and distal, superficial and deep, right and left, and ipsilateral and contralateral, which are actually not shown on this slide, but they're the only ones. And here is an explanation of the different anatomical direction. So superior means towards the top of the head or above. Inferior means towards the feet or below. Now, included in here in unbolded print is the word rostral, which is not used at all in this anatomy class, but it means towards the nose, as in towards the nose of a mammal with 4 legs. And then caudal is used in this class, and it means towards the tail, as in an animal with 4 legs, but also towards the tail of a human. Anterior means towards the front, posterior means towards the back. Medial means towards the midline of the body, and lateral means towards the side, away from the midline. Proximal means towards the attachment of a limb to the body, and distal means towards the end of a limb. Superficial means towards the surface of the body, and deep means towards the inside of the body. Ipsilateral means on the same side as a reference point. So the right leg is ipsilateral to the right arm, and the term contralateral means on the opposite side from a reference point. So the left leg is contralateral to the right arm would be an example. Here's the anatomical directions picture. Okay, introduction to anatomy. Anatomical sections and planes. And these are used all the time also. So a section is a cut through the body. The word section comes from a Greek word that means to cut. A section forms a plane, and a plane is a flat surface that passes through the body. The most common sections and planes are cross or transverse section or plane, which means cutting across the body, sagittal section or plane, which means cutting as like an arrow or like a bow and arrow. Something that you can't see my hands, hold in front of you like a bow and arrow. Coronal or frontal section or plane means cutting in the plane of a little crown that could be worn on the head. And if you cut a cross or transverse section, you are dividing the body into superior and inferior parts. If you cut a sagittal section or plane, you're dividing the body into right and left part. You can also use the term mid-sagittal, meaning that you divide it right in the midline, or parasagittal, which means that you divided lateral to the midline. If you cut in a coronal or frontal section or plane, you are dividing the body into anterior and posterior parts. And this picture from the anatomy coloring book shows you the kind of sections you're making. For example, in coronal section over here, we see that the body has been divided into an anterior and a posterior part. And here's a picture and some text. There are other anatomical sections and planes. Cross sections are cut across the axis of a structure. Okay, and an axis of an organ or an organism is the line drawn through it about which it is roughly symmetrical. So here's a simple example. This might be a piece of intestine, which would be a tube with a central lumen, is what it's called, going through it, like canal or lumen going through it. So a tube. And if it was cut across, that would be a cross section across the axis, which would be a line going right through the center of the lumen, whereas a longitudinal section would be cut in the long axis of a structure. So now, cutting not across the axis, but along the axis. And then oblique sections are cut on a slant through a structure, often unintentionally. So sometimes on histology slides, a cross section was done by mistake. The cut was a little oblique. I'm actually not aware of an oblique section that's done intentionally. Okay, so why are we cutting people and tissues? Well, we want to examine bodies, so bodies can be sectioned or cut and examined to see what's inside them. Tissues can be sectioned, put on histology slides, and examined for learning purposes. And here we see a cadaver, a cross section of the abdomen, and a histology slide, a cross section of a piece of small intestine, cut very, very finely. All right, clinically, anatomical sections and planes are used in imaging studies like X-rays, CT scans, MRIs, and ultrasounds. And here we see a frontal plane of the chest done using a chest X-ray, a cross section of the abdomen done using a CT scan, sagittal section of the brain using an MRI, and a sagittal plane of a fetus using an ultrasound. All right, and here's a note on clinical correlations um, in which there are cross-sectional cuts of a body, for example. This might be a CT scan or an MRI. When the imaging study shows the views in cross sections, the sections are usually shown with the patient supine, so laying on their back, they could be holding bowls of soup, and the observer standing at the feet of the patient and looking towards the head of the patient. Therefore, the patient's right side is on the left side of the image that the observer is looking at. Okay, introduction to anatomy, body cavities.